I'm Dr. Odunsi, and I'm an OBGYN physician, and I treat painful periods all the time in clinic. Some people manage painful periods very well, while others don't know what to do about their painful period. In this video, we're going to talk about the causes of painful periods, how to diagnose it, and treatment options. Here's what we know about painful periods. When I have a patient that comes in to talk about this, I reassure them and let them know that pain is not normal just because it's common. What happens during your period is you release what's called prostaglandins, and that's what makes the period uncomfortable, but it doesn't make it normal. The time when I want you to come see the physician is when this is disrupting your life. So you're missing days of work, of school, you're not able to fully participate in the activities of daily living. That's when it becomes a problem, and that's when I want you to see your doctor. When a patient comes to me, I have a strategic way of approaching painful periods. The first is to get a history. I want to know, when does the pain start? How long have they had the pain? Does it move? How severe is the pain? Have they tried any medication to relieve the pain? Is it associated with anything such as eating, drinking? There are different organ systems around the uterus, including bowel and bladder. So we want to also rule out issues with the GI tract as well as the urinary system. The next thing I'm going to do is a physical exam because I want to maybe reproduce the pain that the patient's having. So I'm going to do an abdominal exam and see if I can reproduce that pain. Then I'm going to do a pelvic exam, and I want to see if the pain is reproducible internally. There's typically not blood work that would give me an answer to this question. It's a lot of how the patient is presenting and my physical exam. I don't get imaging unless I'm suspicious that there could be some sort of mass there that's causing this pain or some sort of growth causing this pain. Let's talk about the most common causes of period pain. Number one is the actual period itself and those prostaglandins. To manage that, I do a trial of NSAID treatment. I encourage my patients to start taking NSAIDs, commonly known as ibuprofen. The next thing that could cause period pain would be some sort of scar tissue inside the pelvis. Things that can cause scarring would be a history of surgeries. Any surgery done on the abdomen can cause scar tissue, and that scar tissue can hurt. Other things that cause pain during the period could be endometriosis. Endometriosis is where that tissue that lines the inside of the uterus is found either within the wall of the uterus or outside the uterus, most commonly on the ovaries. Not only is the lining bleeding, but that tissue, those implants that are found outside the uterus, they're also bleeding, and blood is an irritant and can also cause pain. There are organs around the uterus that can be inflamed, and that endometriosis tissue can also be deposited on those areas. It can be on the kidneys and the bowel, and that's uncomfortable. There could be a mass causing pressure and pain the pelvic region. Let's talk about treatment options that you may have. First of all, it depends on what is causing the pain. I do a trial of ibuprofen or NSAIDs that patients can try 2 to 3 days before the period comes on, and that keeps them ahead of the pain. The second would be conservative things such as heating pads, changing the diet so there's less inflammatory food. Sometimes that can irritate an endometriosis and cause GI issues with period pain. The next would be medical management. We talked about taking the NSAIDs, but one of the things that could be taking hormone suppressive therapy. Simply stated, that would be birth control pills. Birth control pills help to quiet the ovaries. If you have those endometriosis implants on the ovaries or anywhere else in the body, it quiets the ovaries so that you're not having this constant inflammation and painful periods. Now let's talk about the treatment options. The disclaimer is that it depends on what is causing the painful periods. The most conservative way to manage the painful periods would be with diet, exercise, lifestyle modification. You can also use a heating pad. Sometimes that helps with the pain. And particularly for endometriosis, we use hormonal therapy to quiet down the tissue outside the uterus so that the pelvis is not so inflamed and irritated. Then once the quality of life is not improved and conservative management is not helping, I may need to do a surgery. I may need to do a laparoscopic case case where I look inside the uterus with a small camera and see what could be causing this pain. There could be cysts or other masses in the pelvis, and I may need to remove those, and that may help with pain relief. I understand that painful periods are very uncomfortable and they may be disturbing your life, but I wanted to let you know that it's a common issue. There is help out there. So schedule an appointment with your OBGYN to discuss this issue if it is bothering you. And I don't want you to be embarrassed either. So schedule that appointment.